This interview is brought to you by NTT Data. Federal health agencies work tirelessly to protect us from health and safety threats that arise at home and abroad, so we work tirelessly to bring them reliable, cutting-edge IT to improve productivity, leverage data, and save lives. As a top 10 IT service provider, NTT Data can help your agency put modern IT solutions into motion with our proven end-to-end practices, platforms, and services. Together, we can streamline government operations, implement AI successfully and responsibly, and improve public trust. Visit nttdata.com.
Hi, and welcome to the start of our 2025 HIMSS conference coverage. I'm Sarah Seibert, Managing Editor with GovCIO Media and Research, and with me today is Bill Tinston, Director of the Federal Electronic Health Record Modernization Office. Bill, it's great to see you again. Thank you so much for joining the conversation.
My pleasure.
So FEHRM's goal is to unite the Defense Department, Department of Veterans Affairs, Coast Guard, and NOAA, along with other federal agencies, to deploy the same federal EHR. To kick things off, VA recently announced its plans to resume the rollout of its EHR in mid-2026, focusing on recent feedback to drive continuous improvement. So what role has FEHRM had during the pause, and how are we helping shared lessons learned to drive improvements once the program resumes?
Well, it's key to recognize when you think of why the firm's here and what our role is. It's key to recognize the DoD and VA and Coast Guard and NOAA, and hopefully in the near future, the Armed Forces Retirement Home and other partners join. That we're delivering one record, one baseline, one system across the health systems that we're supporting. So the firm is engaged every day with people from both departments, making sure that we have a common baseline shared. There's room, so let's be clear, there's room for different workflows and different processes where appropriate for each organization within the software that we're deploying. But the firm is in the middle of the conversations about change, what the requirements should be, what the capabilities should be, how they're made, and then making sure, because you know that DoD has completed deployment. You know that we had an incredibly successful deployment at North Chicago, at the joint facility in North Chicago that supports Navy accessions as well as veterans. We're very deliberate and organized about formally capturing lessons learned and sharing it amongst all the partners. But I like to point out when asked, and you did ask, that we have conversations every day. So information exchange between DoD and VA happens 1,000 times a day at 1,000 different levels because we work as one team. And the firm is part of that. The VA, the VHA are part of that, the VA program. The DoD program, MHS Genesis, the PEO DIMS, as well as the Defense Health Agency are all working in concert to make sure that we serve the Americans that have served the country as best we can. Be they military members, families, or veterans. I'm the son of a veteran and the brother of a veteran, and I think that is key. And it's part of what gives me the commitment that I have to driving towards success with a single electronic health record, serving veterans and military families.
Yeah, you mentioned a lot of the successes already, and I think the last time we spoke was actually in Chicago before the rollout in North Chicago.
Yeah.
So are there any other achievements or recent milestones that you've seen with the program that you'd like to highlight?
First of all, North Chicago was extraordinary. Best deployment for DoD, best deployment for VA, and an incredibly improved position for the folks that operate the health system in North Chicago, because they're now working on one EHR, right? And they can share patient information much more readily than they used to. But subsequent to that, you mentioned up front, the VA has announced that they're going to start deploying mid next year, mid 26. I don't know if you or others that are watching this watched the hearing, the HVAC Tech Mod hearing, where Dr. Evans and Oracle and the IG and the GAO were talking about what they can do to accelerate. And there's clearly demand to get this single record and create the interoperability that's going to drive that support of the two healthcare systems with one another. I expect to see a lot of demand for acceleration and change and proof that we can do this and do this more effectively going forward. So that we talked up front about the Joint Health Information Exchange and how we exchange data across the community healthcare system and all the federal healthcare partners. That's incredibly important what we're accomplishing there. And then this gets missed sometimes, but we're spending a lot of time on exposure data as well, getting the right standards in place to capture exposure information. An exposure that happens when somebody's deployed in the military has an impact. And we've made commitments as a nation to those people that we're going to provide the right healthcare based on potential exposures, but there's also benefits associated with it. So capturing that information, making it bidirectional, making sure that we share it with providers, with the benefits determination people, and then if something's identified in a clinical setting, that we can capture that as well. So I think that's a pretty powerful thing that we've been focused on lately.
Yeah, that's really exciting, especially I know claims have been through the roof at VA after the passage of the PACT Act. So having that correct information on exposures would be great for the federal electronic health record.
So we've reached a point where working with the partners that collect the information, we're presenting it within workflows in clinical encounters at this point. So pretty powerful that we're able to do that. We continue to work the standards so that we can exchange that information in our health information exchange process as well.
Yeah, that's amazing.
Yeah.
And as we are a couple months into the new administration, there's been a push from leadership to drive transparency and accountability in healthcare.
Yeah.
So how does the federal electronic health record support these calls or shift your approach at all?
Well, it doesn't shift my
Yeah.
approach at all. I'm super excited by the focus on streamlining, the focus on interoperability, the focus on veterans and military members' healthcare. I'm invigorated by what I expect to happen, what I hope will happen, and the opportunities that I see almost cascading towards us in this new space. Well, new space in this new environment. Same space, new environment. I expect I read the news, right? You guys read the news. There's a lot of push, and I think we're well positioned with a single record, a common platform between the two major largest federal healthcare providers to allow decision makers, one, to have the data they need to understand how healthcare delivery is working, what the impact of changes and processes are, but really that common platform that allows you to make decisions about how the DoD and the VA and other healthcare providers work together. Taking IT out of the equation, right? You don't have to go ask the EHR people, hey, can we do this? I think we're putting DoD, and especially as VA gets their deployments on track, the DoD and VA in a position where the people that need to make the decisions about how the two healthcare systems work together how they support each other, how they share facilities, how they share information on patients, how they coordinate care across the two systems. It's amazing, I think, what we're enabling to be done here. I watched the president speak with Larry Ellison next to him about AI and healthcare and what they were bringing to the table. And I won't pretend to be an expert in AI, but I do know, and I've listened to people talk about it, that AI is as good as the data it's trained on, right? And the data it has to work against. We have the data. We're creating that common data set about military members and veterans so that we can train the tools, but even better, get the insight across the population and give the insight that the clinicians need to provide better healthcare and
Right.
whatever else, right?
That's right. Yeah, it's super exciting to see how it can drive efficiencies, but also improve healthcare. We have a couple other interviews set up when we're on site at HIMSS, but
Yeah.
looking forward to learn more about the AI aspect of it all.
Mm.
So moving forward, what are some of the next steps with the federal EHR? Are there any targets that you're eyeing in the near future?
So I mentioned up front, we're working and hoping to get the Armed Forces Retirement Home, which is a small organization, but listen to the title, the Armed Forces Retirement Home in DC, and down in Mississippi. Can't wait to do that. I mean, they're veterans, they're former military, retired military. These are the people that we create this record to support. So I can't wait to bring them on board. We still have some issues to work out in getting that accomplished. We just did Block 12, which means nothing to you, but twice a year. So this is a system that's about change, continuous improvement, continuous integration. So we do two major introductions of capability and upgrades a year. Block 12 was just done very successfully. We get better and better at doing this. That delivered some key pharmacy capability that's critical to success for the VA. The VA, with their integrated healthcare, just has some different pharmacy requirements than the commercial system had built into it, and we were able to deliver that. So that should really open up the aperture on what we can do for deliveries on the VA side. So that's the near-term stuff. Long-term, right? We've created this foundation of capabilities that DoD and VA have invested a lot of time, money, effort, and really changes what can be done for those healthcare systems. But for the smaller, or not so small, but smaller than VA and DoD, federal healthcare providers, I look forward to people looking at what this federal electronic health record does, because when other people join it, the incremental cost is dramatically lower than trying to set up your own electronic health record, right? There's an effort going on at IHS, Indian Health Service. We're always in contact with them, providing whatever advice or they wish. I know State Department has got stuff underway. I don't know where those go, and I'm not predicting where those go. And I know there are other federal healthcare providers. So any way that we at the firm and DoD and VA, as part of as the creators of the firm, can help other federal healthcare providers get the right capabilities, get the best capabilities to support their beneficiaries, I look forward to being a part of that.
Yeah, that's super exciting. And it's great to see the progress. I feel like every time we talk, there's something new. So
Yeah,
great
it is
to
kind of
follow
cool.
along. Yeah.
Hey, I don't know if you noticed, but sometimes they call me Santa Claus around here with the beard. So I'm more than 30 years old at this point. I'll just leave it at more than 30, and
No
I'm still
way.
here. And I'm still here because this is super exciting. I get motivated every day morning when I wake up because I get to be a part of creating this common platform, this single electronic health record that supports. I mean, they yell at me for saying this because it's corny, but it's Americans, right? We're supporting Americans who have supported all of us. And what better mission is there in the world? There's just not that I can think of anyway.
Right. No, I totally agree with you. Before my current position, I was the VA reporter.
Yeah,
And yeah, I totally felt the same way about it. Like people that are serving us to then serve them in the
right.
ways that meet them where they are. So looking at the healthcare landscape holistically, what are some of the top innovations you're keeping your eye on? And what technologies do you think will be game changers?
Clearly AI. And I said earlier, I don't pretend to be an expert, but I know that we are positioned to take advantage of AI as the industry brings new tools to bear against the problems in healthcare, right? And I don't know the shape, the form. What was it? I mean, you're not old enough. Remember the Wonder Twin powers? I don't know what shape or form they're all going to take, but they're going to take interesting shapes and forms, and they're gonna drive better healthcare outcomes and better understanding of population. So I think that's probably the biggest thing. And in the short term, to get there, what's happening in the federal EHR, and I didn't mention this earlier when you said milestones, is we're really transitioning. At its core, this is an Oracle Health platform based. It is not strictly Oracle Health, but the core platform is Oracle Health. And we are positioned right now where we're shifting all of the operations to cloud-based, right? Infrastructure as a service initially, but really changing the way that this is delivered and taking more complete and more fundamental advantage of the capabilities that the software provider delivers in a more evergreen fashion, right? As they're delivered, we'll be able to accept them and will benefit even more strongly from their insights in the broader market that they serve. So I'm super excited about that. And that brings a lot of new capabilities to the table. I don't even know what they all are going to be. And they're not all in the AI space, right? It's a different way to deliver. It's a different way to manage. It's a lot of inherited protections and capabilities that we'll be getting that DoD and VA have to provide on their own right now. And it's a really exciting place to be. And that's really our biggest focus. And it's the most probably joint thing that we're doing. This is a space where the firm is ensconced in the middle of making sure that we don't create outcomes that degrade the ability of any of the healthcare systems that we're supporting to deliver that healthcare, right? So it's a big change. It's where I'm focused, and I think it opens up the gate for countless improvements going forward.
Yeah, I totally agree. I'm super excited, as I said, to watch everything evolve. And thank you so much for joining me today to walk through the latest progress with the federal EHR.
Sure.
Hope we can connect in the future and see what else is new.
Sarah, it's always a pleasure. I'm always looking forward to the next time we have an opportunity to talk. And so thank you for taking the time today.